episode of Doc Talk Live, a health show brought to you by Dallas Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. It is also sponsored by Comfort Care, the hospice-related services throughout the entire DFW Metro. My name is Dr. Sylvie Simon, and I will be co-hosting today's show with Dr. Shree. We have several great shows scheduled in the upcoming weeks. More details can be found on our website, doctalklive.com. Again, it's DOCTALK live.com. And while you're at it, please head on over to our new YouTube channel, Doc Talk Live, and like, comment, or subscribe to see more of us speaking on the topics you would love to hear about. Also, if you are a healthcare professional and would like to be on the show, please do send us a request through our website, Doc Talk Live, or through our Doc Talk Live Facebook page. So before we start, we have some announcements. Actually, Dallas Renal Group is excited to partner with the Texas Kidney Foundation to offer free tests and free resources about kidney health on Saturday, November 11th from 9 to 4. Please mark your calendars. That's Saturday, November 11th. We will be at the Central YMCA Family Center in Arlington. These free screenings are available for all adults. Also, a message from Sankara Eye Foundation. They invite High Octaves with finalists from Z Sarigamapa, The Voice, and some of the best musicians from across the country. That will also be on November 11th at 7:30 p.m. at the Eisman Center in Richardson. Tickets and information can be found on giftofvision.org. We hope to see you there.
Good evening, listeners. This is Dr. Shree, your co-host today for Doc Talk Live. We have a great topic lined up for you all this evening. We've had several nice topics and talks on different types of cancer. And today we're going to be talking about thyroid cancer. Even though this is not a very common cancer, I think it's important for us to know about this disease, what to look for. And that's why we have the experts with us in the studio, Dr. Claude Denham and Dr. Robert Mennel in the studio with us. To be part of the conversation, you can call us at 972-235-5555. Once again, the number is 972-235-5555. We'll be happy to take your questions live throughout the show. Dr. Denham and Dr. Mennel, thank you so much for joining us this evening to spend your time with us. Would you please introduce yourself to our listeners? Dr. Denham first.
Yeah, I'm Dr. Claude Denham. I'm a medical oncologist in the group Texas Oncology, and I practice at the Baylor Sammons Cancer Center at Baylor University Medical Center, close to downtown. I see a wide variety of cancers. The bulk of my practice is probably lung cancer, thyroid cancer, and some head and neck cancer as well. I'm very excited to be here and talk about this topic.
I'm Bob Mennel. I'm one of Claude's partners. I also practice at Baylor University Medical Center. I've actually been there for a very long time, having come there in 1979. I also have done general oncology, but have a few areas of special interest, especially sarcomas, people with the unknown primary. I do see some of the head and neck cancers and thyroid cancers, and also see women with breast cancer and GI cancers. I'm also happy to be here.
Well, we are very happy to have you guys here on the show. So again, we are live in Doc Talk, or live at Doc Talk Live, and we are discussing thyroid cancer with the specialist today. So to begin our show, I'd like to just share some statistics about thyroid cancer. The American Cancer Society estimates about 57,000 new cases of thyroid cancer for 2017. The deaths from thyroid cancer average about 2,000 a year. So still very prevalent and an important cancer, I think, to be discussed. So with that being said, Dr. Denham, can you explain to us what is thyroid cancer? And first of all, what is your thyroid gland?
The thyroid gland is situated in the front bottom part of the neck. Its main role is in regulating metabolism by producing a hormone, thyroxine. There's actually a couple of other glands that are attached to it that have a minor role or role in calcium metabolism called the parathyroids, but we won't be talking about that much today, mainly thyroid cancer.
All right. Dr. Mennel, for you, what are the different types of thyroid cancer and who is at risk for cancer, and are there any risk factors for thyroid cancer?
Sure. When I think of thyroid cancer, I think of basically 4 different types, although there's 5 that you look at. The most common is papillary, with following right behind it with follicular, and they make up about 90% of the cancer. So when you're talking about cancer of the thyroid, you're usually talking about those 2 different cell types. Medullary is much less common. It only makes up about 4%, but it's very important because it has a clear genetic inheritance in it. And this is a type that can be within families, and if one person has it, you need to be aware that other people in the family may have it. And then the last one that I think about is anaplastic, which behaves completely different than all the other thyroid cancers. I think we should emphasize that you can have thyroid cancer. It tends to be a very indolent disease, even if it's metastatic. Anaplastic is a very, very aggressive disease. And the last type is a Hürthle cell, which is a fairly unusual tumor and is probably follicular in origin. The people that are at risk of it, we don't see as much anymore, but way back when I was a kid, you used to radiate people for acne and also for big thymus glands, and that clearly raised the risk of it. Women have about a 3 times greater prevalence than men do in having it as well.
And what are the risk factors?
Well, I think the risk factor basically, like I say, would be radiation, which right now we don't really do that very much anymore. Some situations people feel that if you are low on iodine, that puts you at an increased risk, but now we supplement our foods with iodine, bread and things like that, so it's not much of a risk factor.
All right, we have a caller. Let's take the call. Hi, welcome to Doc Talk Live. What's your question? Yeah, just Dr. Denham.
Yeah, this is Dr. Denham. Hypothyroidism is, of course, a different type of disease where the thyroid gland is underactive and doesn't make enough thyroid hormone to regulate the metabolism appropriately. And so people do take supplemental thyroid hormone, a tablet once a day, and generally that's a lifelong thing. I mean, it'll need to be monitored by an internist or an endocrinologist, but for most people, if they're diagnosed with hypothyroidism, they'll take thyroid hormone for the rest of their life.
Now, I know a lot of people who are hypothyroid, and I know you guys are oncologists, and you probably, you're specifically discussing thyroid cancer, but is there any link or reaction or, relation to being hypothyroid and risk of thyroid cancer that we know of?
No, generally we don't think of that being associated with thyroid cancer.
Okay. Dr. Denham, how exactly is thyroid cancer diagnosed?
Well, that's very interesting because, we're diagnosing many more cases now, somewhat because it may be becoming more common, but also because we're finding it through other x-rays. In other words, in the process of evaluating someone for some other illness, a lot of times we'll find a nodule in the thyroid, and that'll prompt additional testing and biopsy. Because thyroid nodules are very, very common, and there's typically a way of assessing those by doing a sonogram, which is kind of like a special type of x-ray to evaluate the nodule. And if it looks like it's suspicious for a malignant nodule, then they'll do a biopsy. And if that confirms malignancy, then surgery. Sometimes the biopsies are inconclusive, so the surgeon would go in and take out just part of the thyroid to get a more accurate diagnosis.
So like you said, it's picked up on imaging for maybe some other reasons, but will there be any symptoms that patients present with signs of thyroid cancer? Go ahead, Dr. Mennel.
Yeah. Actually, I think most people don't present with symptoms with this. And I think, as Claude said, and the way it's picked up, the way we see it most often is people that are getting especially like a PET scan or a CAT scan for some other reason and you find the nodule. I think we need to emphasize that that doesn't mean you have a cancer. Actually, only 15% of those nodules will turn out to be a cancer when they're worked up the way that Claude has described.
Thank you. So, hello guys. Just those of you who are tuning in today, we're live in the studio with Dr. Denham and Dr. Mennel. They're both oncologists. We are discussing thyroid cancer. For questions to our experts, please call the studio at 972-235-5555. Again, the number is 972-235-5555. Let's go ahead and take a live caller. Sorry about that. Hi, welcome to Doc Talk. What's your question? Hello? Welcome to Doc Talk. What's your question? Okay, thank you. Well, let's see if our doctors can answer that.
So this is Dr. Mennel. I appreciate your question. I suspect that these are unrelated things that we're looking at. You're describing three common problems that we can see. I think that there's not a relationship between thyroid cancer, obviously, in this, and the hypothyroidism may be completely unrelated to it. I mean, there are conditions where you can have a autoimmune disease that can give that to you, but I think that would be very unlikely in your situation. Thank you.
Thank you, guys. Thank you for your calls. Thank you, Dr. Denham and Dr. Mennel, for being here. So again, we are about to go into break. We are discussing thyroid cancers. The number to the studio is 972-235-5555. We'll be right back after the break. Please keep your questions coming.